Around 53 men and 78 women over 30 die as a result of hypertension every single day in South Africa. And it's therefore crucial to have your blood pressure checked. And it's now impacting an increasing number of young people. Dr. Angela Murphy, a specialist physician, shares insights on how the condition can actually be managed. And she joins me now for this important conversation. Doc, thank you so much for your time and good morning to you. I think let's start with the definition first. For us who obviously didn't go to med school and we know just the generic definition that we read out in our books. But how would you define hypertension? What exactly is it?
So our hypertension, good morning, Tamelo, and to all the viewers. Hypertension is defined as a blood pressure above 140 over 90. And this is what we call the systolic over the diastolic. This is a definition that in South Africa, our guidelines concur with the rest of the world. And then we grade it in terms of first grade, second grade, third grade, as the high blood pressure gets higher and higher. But as soon as it's over 140 over 90, greater than that, we say it's hypertension.
Doc, I find it equally concerning that it's also deemed a silent killer. Why is it so? Why is it the silent killer that almost is only detected when it's late?
Unfortunately, there are no specific symptoms to let a person know that they could have hypertension. So, in fact, you can see a patient for the first time when they already have a quite severe complication. I saw a patient quite recently whose only complaint was she'd lost some vision in her left eye. And when we checked the blood pressure, it was 260 over 130, and she had no other symptoms. So unless we go out and we ask people to have their blood pressures checked, on a regular basis, they may not know for years and years that they've got high blood pressure.
And we're going to talk about, World Hypertension Day and the importance and significance of this campaign in just a moment. But let's talk first about the facts, because I want us to paint a picture of how dire the situation is in terms of what the numbers look like in the country and how do they compare worldwide. So what does the data tell us in terms of how many people actually do suffer with hypertension?
We believe 1 in 3 South Africans will have high blood pressure, but not necessarily all of them will be diagnosed. And this is pretty much on par with the global pandemic we're seeing of hypertension. Unfortunately, that means that the increased incidence of complications are going up. So we're seeing on a daily basis up to 1,400 heart attacks, 2,000 to 3,000 strokes. And hypertension remains the leading cause of end-stage kidney failure. So the numbers are very concerning.
And I mean, growing up, Doc, I have to admit, we heard of high blood pressure or hypertension being a senior citizen's disease, something that only the elderly go through. But it seems the stats are showing us a different picture here when it comes to also the younger group.
That's of great concern. We are seeing younger patients diagnosed, and of course, this is very likely due to the change in lifestyle compared to previous generations. Our diets have changed. We are exposed to much more salt, for instance, in the fast food, ready-made meal diet, as well as the fact that a lot of our jobs are much more sedentary than generations gone by. So this combination is actually leading to this increased risk to see high blood pressure in younger and younger patients.
That informs further on, Doc, the need for campaigns such as this, World Hypertension Day, for more education, awareness to be raised, education. Just emphasize and further elaborate the importance of this, because I don't think it's a conversation we see every day around our circles. I mean, on the dinner table. But if this is killing millions of people every day, then maybe it should be. Maybe the time is today.
There's no doubt hypertension doesn't gain the type of interest and enthusiasm to do something about it the way, say, breast cancer does. But the reality is that it is actually a killer. So from about 2006, we've had World Hypertension Day marked on the 17th of May. And this has really been driven by organizations like the World Health Organization, the International Society for Hypertension, particularly in lower and middle income countries where we're seeing this increasing numbers of hypertension. So we would really urge everyone in the month of May, we call it May Measurement Month, get your blood pressure measured. And you can follow campaigns such as Because I Told You or Because I Asked You on social media, which is saying to our loved ones, please go and have your blood pressure measured. If you don't measure it, you may never know that you actually have high blood pressure.
And there's no excuse because, I mean, it is free, especially for this month, to get that measurement and that test done for your BP. So very important, not just to talk about it, but act on it. But Doc, also when we talk about treatment or even preventative measures, are there any for us to also consider?
So even if you're diagnosed with high blood pressure, in the first 6 months, we often say to the person in front of us, let's try and change lifestyle and get that blood pressure down without necessarily initiating medication. Of course, it depends on the severity of the high blood pressure, but lowering salt in the diet is incredibly effective. It can actually have the same effect as one single blood pressure agent, for instance. Getting weight back to normal. We know in South Africa, unfortunately, our average weight is not good. So working on that is with a general healthy diet and increasing activity. There's no doubt that, walking and getting up to 100, 150 minutes of activity per week is good. If after that time blood pressure medication has to be initiated, the medications are available. Most of these medications are on the essential drug list, and there really is no need to think that we can't access that care. Our main challenge is convincing people to stay on the medication because, of course, they feel well, and it seems really strange to have to swallow pills every day. So it's important not only to get the diagnosis, but to have the follow-up, to be reassured that the medication and lifestyle changes are actually achieving something.
Yeah, and I'm sure you would agree with me as well that early detection and diagnosis can avoid, or rather, prevent avoidable death, because you can avoid death. Yeah.
Absolutely. If we reduce that blood pressure with, the combination of lifestyle and medication back into the normal range, we know absolutely categorically that we will reduce complications.
Well, I appreciate this conversation and you joining me for it. Dr. Angela Murphy, thank you so much for joining me right here on the South Africa, rather not the South African Morning News Link. I have to get used to the fact that this is News Link, not the South African Morning, but the specialist physician, Dr. Angela Murphy, talking to us rather about World Hypertension Day, but also the importance of knowing that this month you can, of course, make use of the free testing and screening measurements that you can get, of course, during the month of May Measurement Month. But also keep the conversation going in terms of raising awareness, normalize having these discussions and ensuring that you do make that important lifestyle change that will better your health.